Hello, this is Dr. Mike Stoner bringing to you this month's MEC Minute. Here we'll be talking about a brief overview of child abuse and child neglect. So our objectives for today are to discuss some unique opportunities for EMS services on child abuse and child neglect, talk about state and federal definitions for sexual abuse, describe some common injuries that are seen with physical abuse, identify different types of neglect, and finally discuss some mandated reporting that need to be made. So to start off, the question is, will I ever see child abuse? Well, in actuality, we are just seeing the tip of the iceberg. Some statistics here, 2017, approximately 674,000 children were considered victims of child abuse or neglect, and that was out of 4 million referrals, which makes it about 9.1 per 1,000 kids experience some sort of child maltreatment. So that's about 5 children per day nationwide and about 6 children per month in Ohio. Of these, 3/4, or about 75%, are due to neglect. About 18% are due to physical abuse, another 9% are due to sexual abuse, and about 2% are due to medical neglect. And we'll talk about definitions of that later. In 2017, a little over 1,700 children died as a result of their child maltreatment. Here in Ohio, there were 73 deaths in 2017. And the question comes in, great, that's all of Ohio. What is it locally? Well, one of our pediatric abuse fellows did a study looking at the last 5 years of what's locally in Ohio. She actually worked with Columbus Fire and looked at the pictures you see. The graph on the left, the red area is what our EMS runs for kids, and then the right graph or picture shows where the abuse is. Basically, you see the majority of it is kind of centered around downtown Columbus, right around Nationwide Children's. Oh, great. The average in Franklin County is about 6 cases of abuse per 1,000 pediatric runs. So it is out there. If you can see on the east side, it definitely will encompass our catchment area. So let's talk a little bit about child abuse. It comes in 3 main forms: child sexual abuse, physical abuse, and then emotional abuse. We'll start off with sexual abuse. So sexual abuse is defined as any complete or attempted sexual act, sexual contact with, or exploitation of a child. The laws do vary by age. Ohio's guidelines laws vary by state. Ohio's guideline varies a little bit by age. Here's a chart. I won't read it to you, but basically it says that any child under 13 involved in a sexual act must be reported. Any child under 16 when the partner is 18 years or older must be reported. And then there's a year differentiation you can see on the graph. Finally, regardless of the victim's age, if the sexual acts were forced or coerced, or the perpetrator is in a position of power, like a teacher, coach, parent, guardian, there is a violation of the law and it must be reported. This is a little rewording of the Ohio Revised Code, but that's the basic gist of it. So let's give some examples here. All right. So an 8-year-old female who reports that her 16-year-old stepbrother touches her genital areas. That is reportable. She's under 13 and everything. She has no way to consent, so report that. Another one, a 17-year-old male reports being forced to perform oral sex by his piano teacher. Again, we don't know the age differentiation, but she is in a position of power, so she cannot do that to him. And then finally, a 13-year-old female reports that she and her 19-year-old boyfriend had sex the day before. A couple of issues here. One is it consensual? Well, even though it's boyfriend girlfriend, she is 13. The age variation is way too big. She cannot consent to that. So no, that is not defined as consensual, and it needs to be reported. Second, it was only a day before. She could be she should be seen and have a sane exam. So, uh, what is entailed in the sane exam? Well, in Nationwide Children's, we do have peds sane nurses who are specifically trained to see kids under the age of 16 to do the sexual assault nursing exam. It's based on state law. In Ohio, sexual assault evidence should be gathered within 72 hours for children under 16 years of age. For children 16 and older, it can be up to 96 hours. Let's look at a case. This is a real case. Mom walks into a room, sees her child's father throw a 6-month-old across the room. Mom calls the EMS. They get there, and the kid looks perfect. What should you do? Should you transport this kid? Well, of course you should. The story is very wonky. He needs to be looked at. In this case, the child was actually looked pretty good, but they recommended follow-up. Oops, I went too fast. That kid actually looked pretty good, like I said, recommended follow-up, and he got seen in the hospital. He did not have any injuries, but again, reportable given the history. And we'll go into a little bit what gets done when you report these cases. All right, next case. You're called to a house and a babysitter believes the 4-month-old had a seizure. What should you do? Again, you get there, the baby looks good. Seizures in 4-month-olds are not normal. Whether it's febrile or afebrile, I would have this kid seen. Fast forward to the kid gets evaluated. You find this on head CT. You look at the white arrow, you can see a lot of black area, that's space, probably an old injury. The red arrows point to the darker white area, which is acute blood, which is consistent with abusive head trauma. So abusive head trauma, formerly known as shaken baby syndrome, it can be caused by other reasons besides shaking, which is why we've changed the name to abusive head trauma. Does not require a direct impact. Usually what happens is either an impact or the shaking will cause some bridging veins to tear, and then you'll have the bleeding. It can affect, between 16 and 34 kids per 100,000, less than 1 to 2 years of age. So we do see it quite frequently, unfortunately, within the hospital. So when in doubt, bring the children in. There was a study done about 20 years ago now looking at 54 cases of abusive head trauma injury that were missed in the first presentation. So they came in, they were seen, they thought the child looked okay, sent them out, and then were later found that they probably were abusive head injury at that time. 28% of these kids were re-injured after the first misdiagnosis. About 40 of these kids experienced medical complications related to the misdiagnosis, and at least 4 kids that were sent home initially, came back dead. So why do we miss it? It is very difficult to diagnose at times. These kids can look okay. They can have very nonspecific symptoms. I think that's why we're getting more aggressive on it. A good quality improvement effort has just been started here at Nationwide Children's, looking at these kids, trying to put out some more information. When do you need to pull the trigger and do a full workup? And this is just a short list of things that would make you think child abuse. And it can be obviously things. The child has fractures, that's not normal. But also some things are just subtle. Like, is the child fussy? Is he vomiting and have altered mental status that you don't have a good reason for? Always crying, decreased feeding. These are all kind of very soft signs that could be signs of abuse. So if a child is brought in and we're concerned about abuse, what does that mean? It means my mouse is not working. All right, so what is our standardized approach? Well, so when a child comes in and we are concerned about non-accidental trauma, they get kind of a full gamut of things thrown at them. First, they get a full physical exam to make sure that we're not missing anything, looking for bruising, looking for any kind of tenderness, the works. If they're under 6 months of age, they'll get a head CT. Seems like a big hurdle to jump, but these kids can't tell you that they have a headache, that they're not thinking right. We don't know. So they'll get a head CT. They'll go to skeletal survey, which includes 22 to 23 x-rays of every bone in their body, looking for signs of injury or looking for signs of old injury. Abdominal evaluation, sometimes blunt trauma can be a little difficult to figure out, especially if they are under 5 years of age and can't tell us that their stomach hurts. An abdominal CAT scan has a lot of radiation, so we don't pull the trigger and do that right away. We'll get some blood work looking at some of their enzymes, looking for signs of elevation. If they're elevated, then that's a suspicion for an intra-abdominal injury, and then we will go ahead and get the abdominal CT. Lastly, a couple of reporting systems. The social worker will come in, they'll do a psychosocial assessment, and finally they'll report to Children's Services. From there, the Child Services will look at the case and determine whether they need to investigate further. Why such a big workup? Why talk about this? Signs can be very vague and nonspecific. What are good signs of child abuse? Well, they can come in with pretty upfront things like loss of consciousness, lethargy, hypotonia, seizures. Those are all make sense. Coma, respiratory stress, apnea. It can be something a lot more simple, just irritable. Kids come in irritable all the time. Do they have colic? Are they shaken? Just some poor feeding. The parents are like, he just doesn't want to eat, or some vomiting. So it can be subtle. Looking at the child, you look and do an exam. It can be like the child on the left who is screaming, crying, fussy. It can be the child on the right who just has a bottle in his mouth, or the child that looks very happy right in the middle on the bottom. Sometimes your physical exam is not that not that helpful. Here's some pictures. You get the head CT, you look at the children. On the left, you'll have a picture of a subdural hematoma, and on the right, you have a picture of some acute bleeding where the white is, and then where the arrow is pointing is some reabsorption of some old blood. Let's do another case. You come in, and you're concerned about bruising on this kid. You're called, he's a former 28-weeker, he's having breathing issues. At that point, you notice the bruising on his left cheek. The mom's story is he slept on his pacifier. Are you concerned? Well, face is not a very typical spot for a 5-month-old who can't yet crawl to have a bruise. So back again 20 years ago, they were looking at the data of where kids get bruises, or I guess which kids get bruises. The pre-cruisers, ones who aren't really walking that well or just sitting, looking at 2 different studies, Sugar and Carpenter's study. Ones that are cruising around, kind of moving around, holding on to furniture or crawling around, versus the walkers. So as you can see, as somebody gets a little more mobile, they're more likely to have bruises. What are typical bruises? Of course kids get bruises. What's a typical bruise? A typical accidental bruise, bony prominences. Kids will kind of toddle around, fall, hit their forehead, hit their chin, bang their elbows, knees, shins. But then where are non-accidental bruises? Ears, neck, belly, the genitals and buttocks, arms and legs. Things that show up in patterns are big question marks. Bite marks, and then bruising that have no history is also another concern. Here's a good pictorial of kind of locations that you would expect to see where they shouldn't be. Case 3, 8-month-old comes. You're called in. You see them, and you notice some bruises on the ear. Mom says that he's just starting to learn to pull a stand, and he falls and he hits something. What is the significance of this? Well, bruising to this part of the ear is rarely caused by an accident. Usually blows to the side of the head. Pinching or grabbing the ear can cause this. And sometimes it's the only sign you have that there's actually some kind of intracranial injury or bleeding. Looking at a few more pictures. The one in the, you got some bruising on a couple of those. The one in the bottom looks like it was yanked and starting to have a little bit of a laceration or tear. Out of Chicago, one of the abuse doctors came up with this. They looked at hundreds of children that came in with bruising and found a good mnemonic, or made up a good mnemonic of what is concerning for child abuse. Their mnemonic is 10-4, face is P. So what is 10? 10 is bruising the ears, torso, ears, and neck. For a child that is not terribly ambulatory, or most children in general, to get bruises in the torso, which can include the back, the ears, or the neck, is not normal. 4 months. A kid under 4 months of age is rarely going to get bruises anywhere. He's not ambulatory. He can barely roll over. He's not crawling yet. He should not get a bruise. So then somebody threw in facies. What is facies? Frenulum. You can get a tear of the frenulum in the mouth, angle of the jaw, your cheeks or inside your cheeks, and then eyelids or the subconjunctival area. And then finally, P for pattern bruises. Let's look at some more pictures. So look at this kid. The top left looks like almost you can make out possibly a hand of sorts. The top right, this injury is from somebody grabbing the child by the scruff of the neck and yanking on his hair. On the bottom left, looks like it might be a bruise. And finally, this is a little harder to see. The bottom right, the child's right eye, you can see has a subconjunctival hemorrhage. Not very common. I know as an adult, if you're out drinking all night and you're throwing up, the next day you can get one. Babies don't get that, so that's abnormal. All right, how about this one? You see this kid, he's a little fussy. You look him over, and you're looking at his back, and you see nothing. That's right. The most common exam finding on a lot of these abuse kids are nothing. They look fine. Taken in to get an x-ray, and they have rib fractures. The one on the left is acute rib fractures where the red arrows are pointing, and on the right are some of the healing. You can see what they call the callus formation, the healing rib fractures. But a lot of times you'll see nothing on exam. So you have to go with some of the soft signs like the vomiting or the fussiness. All right. You're called to a house. 3-year-old has blistering to his butt in the lower legs. You get there and you're concerned that he's been abused. Mom says, no, I'm not letting you take the kid. What do you do? Well, in this case, they called the police and Child Protective Services, and they took custody of the child right there and brought him in. So that is one of the options. And it's in our protocols. If you're worried about child abuse, it's an abusive situation, call for backup, call for law enforcement. This picture is kind of what we see, signs of abusive trauma. You can see on the left is accidental and on the right side of each one of the pictures is abusive, and it just writes down the percentage of where you think you would find abusive versus accidental injuries / burns. Here's some pictures. If you just look at the pictures, it's hard to imagine how you would get these burns just by an accident. The kid on the upper right, you have a circumferential right at his ankle burn all the way down on his feet as if he was dunked. Same with the bottom left on the hand. The one in the bottom right looks like they were dunked into the water and just got their butt dunked into a hot bath or a hot tub. All right, so when do you bring him to the burn center? Fortunately, we do have a burn center for children right here in Columbus at Nationwide Children's. But if have a partial thickness burn, that's like 2nd degree, greater than 10% of the body surface area. If it involves the hands, face, feet, genitals, perineum, or any major crossing over a major joint, then they should be seen at a burn center. Any 3rd degree burn in a child should be seen in the burn center. Electrical burns, chemical burns, inhalation burns where you're worried about the airway, and kids that are high risk with pre-existing orders, medical disorder. And then also if they have any associated trauma. Not only do they get good burn care, but there's also the aftermath of any special social, emotional, and then long-term rehab is also available. All right, another case. You're called a 4-month-old is having trouble eating. Mom says he just won't eat. He's been fussy for the past couple weeks, does not seem to want to take a bottle. You open his mouth, you look in, and you can see his frenulum is torn. So what is the frenulum? The frenulum attaches the upper lip, the lower lip, and under the tongue to the rest of the mouth. If you take a bottle and you're saying, stop crying, baby, and you're just trying to shove the bottle in there, hit the mouth, these are all reasons you can tear this, and this is not normal. Kids rarely have it by accident. It can happen, and we'll go over that in a second, but you worry about abusive injury. There you go. Top one, the upper one's torn. The bottom one's hard to see. I think his lower frenulum is torn. A couple more. Tears. The one on the bottom right looks like it's an older injury, which is starting to heal. All right. So, how does it happen? Like I said, it can happen accidentally. A simple fall, trip and hit your face against a table, but you can also cause it. We can cause it in the hospital by when you intubate a patient, putting an OG tube in the patient. You can also get it in not so medical ways, such as getting a blow to the mouth or slap to the face. Again, I was talking about feeding. Baby's crying, doesn't want to eat. You're shoving a bottle, you're shoving a pacifier, you're trying to get them to be happier, to stop crying, and just getting more forceful with them. And then, unfortunately, oral sex forced upon a child can cause that as well. All right, so what are some key points on physical abuse? History is important. Understand the injuries. Age and development are also important. If a child is said that he was running through the house and tripped and fell and hit his face, but he's 3 months old, he can't run. So it's a little bit of an exaggeration, but obviously kids that have certain injuries need to be able to at least have sustained said injuries and have the history make sense. If you find something that you can't explain, you should probably receive further investigation. Again, it goes for the unexplained history, the parents that are changing their story. Mom says this, dad says that, and then mom comes back and says something completely different. That's a little wonky and needs to be investigated a little bit further. Again, back to the development, they're doing something they can't do. Needs investigation. Unfortunately, many children are raised in environments where they are repeatedly exposed to potential harm. In that situation, recurrent abuse associated with increased morbidity and mortality, Sometimes we miss them. It happens all the time. Again, the tip of the iceberg. Don't miss the sentinel event or an opportunity to protect a child. And lastly, the most common physical finding in abuse is no physical finding. All right, let's move on to child neglect. So what is child neglect? Child neglect is failure to provide a child basic physical, emotional, or educational needs, or to protect him from harm. So failure to provide or failure to supervise is the best way to sum that up. So what are our types of neglect? So physical neglect, not giving adequate food, clothing, shelter, or hygiene. An example would be a 4-month-old male who is wasting away, has not been bathed in weeks, his home is dirty, and he's got no food or running water. Moving on, emotional neglect. That's when you're not providing adequate nurturance or affection. You're not giving psychosocial support, allowing the child to use drugs or alcohol. An example, a 15-month-old male who's left in a playpen all day with no interaction from his parents. He's not getting consoled when he's crying. They just leave him there in a dirty diaper. Emotional neglect. Medical dental neglect. Not pretty easy, not giving medical or dental needs. A good example of that one's a 3-year-old female. Some really bad teeth rotting away, or gums are bleeding. Family have missed multiple dental appointments, etc. That's dental, medical. 8-year-old who has asthma is seen all the time for asthma exacerbations, but they never have her inhaler. They don't keep her on her controller medicines. That's medical neglect. Emotional neglect, failure to, read that wrong. Educational neglect, failure to enroll in school, provide the appropriate homeschooling or educational needs. Good example, 13-year-old male can't read because he's never been enrolled in school. Moving on, more types of neglect. Failure to supervise, so inadequate supervision, just not watching the kid. Child who is on their second head injury from riding her bike in the street, no helmet, the adults are not watching her. She just go out and play. Go play in traffic, girl. And then finally, exposure to violent environments. This would be a good one, would be a lot of domestic violence, or child who's in a home who constantly has drug-related shootings, etc. All right, we talked about this in the objectives. So what if you suspect this? Do I have to report? Who should report? Well, a survey in North Carolina showed that EMS often suspected but never reported maltreatment just because they weren't sure it was their job or if they would get in trouble. Reasons that are kind of known why people don't report abuse is sometimes they'll come in, it's a head injury, they're primarily focused on the head injury or laceration, they're focused on the medical complaint and not thinking about how it actually happened or reporting it. Passing the buck, thinking somebody else will report it. It's like, oh, we're going to transfer this patient to somebody else, they'll report it. Not always the case, and the child it could go missed. Some people feel, I don't really know. I think this was an abusive situation, but I don't know 100% for sure, so I just won't report it. And then lastly, what constitutes child maltreatment? It's probably okay. Happened to me when I was a kid. It must be fine. I use that one with my own kids, actually. But not knowing what is maltreatment, so not knowing what to report. So who has to report? Do you have to report? If you suspect it, it's the right thing to do for the children. But in Ohio, I don't believe EMS is a mandated reporter. Mandated reporters include teachers, daycare providers, doctors, nurses, other healthcare professionals such as social worker, therapists, attorneys, psychologists are all mandated reporters. A lot of times on the EMS side of things, you're put in a good position where you are exposed to the patient's environment. You see things that the hospital does not see. So you can make a case that others cannot. So you're doing the child a favor and in their best interest to report it or to pass that along. The case we talked about where the kid was burned and the mother refused to have them transported, the EMS did the right thing. They said, I got to get this kid out of this environment. And they did. And that probably saved that kid's life. So, I don't know. Was it abuse? Was it not abuse? I don't know if I want to report it. What if they get mad at me? Come slash the tires of my fire truck? I don't know. So, if you're a mandated reporter and you decide you don't want to report, it's a misdemeanor criminal offense. If you're a licensed professional, failure to report could jeopardize your license. On the good side is if you make a report in good faith, you're immune from civil or criminal liability if complaints about you intentionally provide false information or unfounded. What that means is if you say something, you were wrong, you did it in good faith, you're not liable for it. Excuse me. So how do you report? Well, here's the numbers for Franklin and Fairfield County. Local law enforcement, where it occurred is who you report to. What do they want to know? They're going to want to know the name and address of the victim you suspect of being abused or neglected, the age of the victim, the name and address of the parents or guardians of the caregiver, the person that you suspect is abusing or neglecting the child, and their address if that's available, why. They want to know why you think it's happening, and any information that you may think is helpful. All right. Kept it on about a half an hour. So that was briefly an overview of child abuse. Appreciate you guys sustaining my first MEC minute. If you have any questions, I put my email address here. You can also reach me through Workplace, yet I'm still trying to figure out how Workplace works. So emailing may be better. I'm happy to answer questions. Otherwise, that's it.